Hi, I'm Kemba Frederick from Texas Women's University, and I will be demonstrating the Screening Assessment for Falls Evaluations, or SAFE. This assessment is designed to be used for seniors living in their own homes or independent living facilities who report a history of falls. It evaluates the following areas: intrinsic risk factors, extrinsic risk factors, and activities of daily living and support issues. Each area is comprised of yes or no questions, which will be added up at the end of the assessment to determine the client's overall risk of falls. Okay, Ms. Smith, what we're going to do right now is we're going to do a screening assessment for falls evaluation.
And what exactly is that?
Well, what this is it's an assessment that evaluates your risk of falls.
Oh, okay.
Okay. So before we start, I just wanted to let you know that I'm going to be asking you a series of questions. Now, if at any time you want to stop or you want me to repeat myself, just let me know and I'll go ahead and do that.
Okay.
Okay. So we're going to start with your primary diagnosis. I see in your chart that you're diagnosed with type 2 diabetes.
Yeah, about 6 months ago I was diagnosed with diabetes.
Okay. Okay. And any other medical diagnosis or medical history?
No, just the diabetes.
Okay. Now, what medications are you on right now?
Right now I take insulin and I'll take a little aspirin if I'm having any pain.
Oh, okay. Over the counter, right?
Yes, ma'am.
Okay. Now, any current, current services, physical therapy or occupational therapy or any other treatments that you're receiving right now?
Mm-mm.
Okay, and let's talk about mobility aids. Were you ever issued a cane, or maybe a walker, or any type of mobility aid?
I don't use those things. I want one.
Okay. All right. And let's talk about your living situation. Now, do you live alone? Does anybody else live with you?
No, I live alone, but my children come and visit a lot.
Okay, and you get help from your children often?
Yeah.
Okay. So what we're going to do right now, we're going to talk about your most recent falls. So let's go back 12 months. In the past 12 months, how often would you say that you've fallen?
Well, I didn't really start falling until about 3 months ago.
Okay.
And within that 3 months, 3 falls, about 3 falls.
In the last 3 months?
Yeah.
Okay, so let's go ahead and talk about those 3 falls. Can you tell me about the most recent time you fell?
Yeah, 2 weeks ago, I was at church. It was a pastor's anniversary service, and I hadn't eaten anything all day, and I was on my way to the restroom, and I felt lightheaded and just fell down.
Okay. And did you trip over anything at that point that made you fall, or was it mostly the lightheadedness?
Yeah, it was the lightheadedness. There was nothing on the floor. I didn't trip over anything. Just, I felt lightheaded and fell down.
Okay. Okay, so that was the most recent time you fall. Let's talk about the next time.
About a month prior to that, I was going to wash the dishes, and I felt dizzy and just fell down.
Dizziness, okay. And again, at that point, was there any obstacles in your way? Anything blocking your fall, or did you slip or trip?
No, I didn't slip, trip, no obstacles, nothing on the floor. I just felt dizzy and just fell down.
Okay. Okay, and you said 3 times, so that's number 2. Let's talk about the third.
The last time was, I was going to do the laundry, and I said, after I do the laundry, then I'm going to go take my medicine. And on my way to do the laundry, I felt lightheaded again and just fell down.
Okay, so that's 3 times lightheadedness and dizziness. Okay. And in that particular time, was there anything you tripped over or slipped, or any obstacles in your way?
Nothing.
Okay. Okay, now let's talk about near falls.
And what are near falls?
Times when you almost fell, but maybe something caught your fall.
Oh, yeah. So you see this slim cord here?
Yes, ma'am.
And that extension cord? Well, I tripped on that very extension cord and grabbed to that chair. Good thing that chair was there because it broke my fall.
Okay. Okay, it's very important to have those extension cords out of the way. So, ma'am, what we're going to do right now is we're going to talk about intrinsic factors. Now, what those are maybe medical factors or physical factors that may have contributed to your 3 falls.
Okay.
Okay, now you already said that you were dizzy the 3 times you fell. Now, let's talk about your energy level during the day. Do you feel it fluctuate during the day?
No, my energy pretty much stays about the same throughout the day.
Okay, and let's talk about that medication. Now, you did say on one occasion that you hadn't taken your medication. How often do you take your medication?
Well, I'm going to be honest. I take my medicine about 3 or 4 times
A week. And how often are you supposed to be taking your medication?
The doctor said to take it every day. Sometimes I forget.
Okay, now we got to be on that. So we have to. They prescribe it for a reason, so you have to take your medication every day, Miss Smith. Now, has there ever been any time when you've fallen and you were not sure why you fell?
I don't think. No. I'm pretty sure it's because I felt either dizzy or lightheaded.
Okay. Okay. And now, upon standing, do you feel dizzy or do you feel unsteady when you stand at any time?
No, I don't feel dizzy or unsteady. But you know what? We have to take a little break. We need to go use the little girls.
Okay. All right.
Oh, I feel much better. Thank you. You want something to drink or some cake or
Oh,
something?
no, thank you, ma'am.
Okay.
Okay, you ready?
Yes, I am.
All right. Let me get your glasses on there.
Okay, I can't see without these.
Okay. So, we already talked about mobility aids, and you said you didn't need any kind of assistance or walk or anything walking. Okay. Now, when you walk, do you have sway to your walk, or do you ever use furniture or counters to kind of prop yourself up when you walk?
No.
Now, do you ever have reduced sensation or weakness in your legs? Okay. Now, have you ever tripped when you're walking? Do you ever trip and fall over nothing? If there's no obstacle, you just trip on yourself?
No, now I've tripped over stuff, but not if there's nothing there.
Okay. Okay, now let's talk about your footwear. Do you ever wear ill-fitting or unsupportive shoes? Maybe some of your shoes are painful?
Yeah, now my high heels are painful.
High heels?
Yes. When I go to church, I wear high heels with my suits.
Oh, okay. Okay. So, do you ever have any difficulty seeing steps or maybe seeing obstacles that are around the house?
Only if I don't have these on, but as you see, I wear these everywhere.
Okay. And let's talk about the lighting in your home. Do you ever walk around with dim lights?
Yeah, that electricity bill can be so high.
Yes, it can.
Yeah, so I keep the lights off to save on the electricity bill.
I can understand that. Okay. Now, have you had a vision test or a vision assessment in the last 12 months?
Well, next month, I'll go get my eye shots again.
Okay. Now, how do you feel about your general safety, or are you concerned at all about refalling?
No, I'm pretty safe. It's pretty safe around here. No concern.
No concerns?
No, I think I do pretty good.
Okay. Okay, now let's talk about nutrition, Mrs. Smith. Have you had any unexplained weight loss?
Actually, yes. I've been eating the same thing. I eat my fried chicken, my pork bones, my cornbread, my cabbage, macaroni and cheese. I eat good. But I keep losing weight. I probably lost about, 15 pounds?
And how long? Over the last...
Probably within the last 5 months.
Okay, 15 pounds last 5 months. And so you eat good, you have good appetite then?
Yeah, I eat. You see that Popeye's bag over there?
Oh, okay, yes, I do, ma'am. Okay. Okay, now let's talk about vision. Okay, Ms. Smith, let's talk about cognition. Do you have difficulty following instructions or directions, or do you get confused throughout the day?
No, now sometimes you have to repeat because I can't hear you, but I'm not confused and I can follow directions.
Okay. And let's talk about your own safety. Are there things that you do to monitor your safety around here?
What do you mean?
Do you maybe pick up shoes that are laying around, put up extension cords, make sure that the hallways are free of obstacles?
Now, sometimes I leave my shoes out or the extension cord may get in the way.
Okay. Now, let's. Have you ever had any incidents where you go to the bathroom a lot?
Yeah, it wakes me up out of my sleep about 3-4 times out of the night. I get up because I have to go to the ladies' room.
Okay. So 3-4 times a night, huh?
Yeah. That can be frustrating.
I can understand that. I can only imagine. Okay, Ms. Smith, do you have any fear of falling, or do you restrict any of your activities during the day, or because you're afraid to fall?
No, because I've only had 3 falls in 12 months. So, no.
Okay. Okay, now I'm going to read your list of medications and tell me if you take any of those. Do you take any antidepressants?
No.
Any medication for Parkinson's disease?
No.
Any diuretics? Sedatives?
I don't even know what that is.
Sedatives are medication that kind of slows you down and they put you to sleep.
Oh,
Any sleeping pills?
No.
Okay, any hypertensive, medicine for hypertensiveness, or maybe medicine for high blood pressure?
No, my blood pressure is good.
Okay. Any psychotropic drugs?
What is psychotropics?
Psychiatric drugs?
No.
Okay, Ms. Smith, now what we're going to do right now is we're going to talk about extrinsic factors.
And what are extrinsic factors?
Well, what those are environmental factors, maybe things in the environment, in your environment, that may be contributing to your falls. Okay. Now let's talk about indoors. Do you have any hazards that are present? I know we already talked about the extension cord, and you mentioned your shoes. What about cluttered rooms, maybe rugs or cords?
No, my house is clean. My room, no clutter in my room. Now, like my phone charger, see how it's laying out there. And I do leave shoes around and the extension cords. And that's about it.
Okay. So let's talk about outdoor hazards. Uneven grounds, any obstacles outside in your outside area?
No.
Now restricted traffic ways indoors. Restricted hallways, your way to the restroom, is it unrestricted? To the kitchen?
No restrictions.
Okay, let's talk about poor lighting. Do you have poor lighting inside or outside?
Yeah, outside on my patio and the front porch, the light bulb is out.
Okay. Now, do you ever have any difficulty climbing steps to your house?
No.
Do you have difficulty getting off out of bed, maybe getting out of bed and sitting on a chair, or maybe getting on or off the toilet or in the shower?
No. No problem there.
Okay, Mrs. Smith, what we're going to do, this is the last part of this assessment.
Oh, okay.
Okay, we're going to talk about our activities of daily living. And what activities of daily living is that things that we do every day to take care of ourselves.
Oh, okay. Like taking a bath and
Taking a
washing
bath.
dishes.
Yes, ma'am.
Okay.
Okay. Now, is there any activity that you do every day, like you said, taking a bath, washing dishes, getting ready, brushing your hair, anything that you do every day that you feel unsafe performing?
No.
Okay. Do you have any difficulty reaching for, bending, carrying any items?
No, it gets a little hard carrying a lot of groceries in the house, but besides that, no, ma'am.
Okay. Unsteady when rushing or turning quickly?
No, I do pretty good.
Okay. Now, when you're in the shower, do you have any difficulty to stand and safely wash your hair, or maybe get dressed?
Well, I go to the salon to get my hair washed.
Okay.
But getting dressed or taking a shower, no problem doing any of that type of stuff.
Okay. Now, if you were ever on the floor, are you unable to get up?
Yeah, I can get up from the floor.
Okay. Okay, now we're going to talk about your activity profile. Now, do you leave your residence more than, I would say, once a week?
Yeah, I have a lot of errands to run.
Okay. Tell me about it. On average, how often do you leave home?
I leave about, let's see, I go to church on Wednesday for Bible study.
Mm-hmm.
Go to church on Sunday. I usually go get my medication on Monday.
Mm-hmm.
And bingo Thursday.
Okay.
So that's about 4 times.
Okay. Now let's talk about your activity level. With walking, do you walk or do you get any type of vigorous activity at least 5 times a week?
No, my kids drive me everywhere, so I don't walk. I'm too old to exercise.
Okay. Now, do you receive any assistance for personal care?
No, I care for myself.
And no assistance also, any assistance for or supervision with mobility, with any activity? Does anybody have to assist you in maybe getting out of the car, into the car?
Oh, no. I do all that myself.
Okay. Okay, Mrs. Smith, well, this concludes this assessment. Now, what's going to happen from this point on is I'm going to go back to my office. I'm going to go ahead and calculate this. And I'm going to come up with a score. And based on what you've told me today, me and you are going to sit back down the next time we meet, and we're going to come up with a plan that is going to tackle or that's going to address the issues that you're having. And hopefully we can find a way to kind of reduce the risk of falls.
You know what? I think we'll be able to do that.
Yes, ma'am.
Okay, well, thank you. I appreciate your help. You helped me.
Yes, ma'am. No problem. Thank you very much. It was a pleasure.
You too.
Ms. Smith's total SAFE score was a 10, which indicates a low number of risk factors. I will later develop a management plan to address the areas of concerns indicated in this assessment.